So we are very fortunate to have with us today Dr. Greg Argyros. He is the president of MedStar Washington Hospital Center. But briefly, MedStar Health, which I'm sure you have seen, heard, or know of, is one of the largest health systems in the United States. And we're here in Mid-Atlantic region, Baltimore and Washington, D.C. MedStar owns 10 hospitals, 7 of which are in Maryland, and 3 are in Washington, D.C., all of which are nationally recognized. Georgetown University Hospital, National Rehab Hospital, and our hospital, MedStar Washington Hospital Center. And Dr. Greg Argyros, the president, I know you've read the bio, but I'm going to just say some of the highlights. He is a pulmonologist by medical training and specialty. He did his undergraduate at the U.S. Military Academy in West Point, did his medical school at University of Pittsburgh, and did his internal medicine training and pulmonary training at Walter Reed before joining Washington Hospital Center, where he was the chief medical officer and vice president of medical affairs, and now the president of the MedStar Washington Hospital Center. So please welcome Dr. Argyros. But I believe, before I get you up here, Dr. Sam Hancock already has a comment before our speaker could even talk.
I'm just going to say, due to this young man right over here, he's the one that signed my paper that got me into a non-operating theater within MedStar. I was attacked on the subway the 26th of July, 2021. And as I told the grand jury, I was one box cutter blow away from death. And so I was attacked on the metro. They said, what hospital you want to go to? I said, GW, because that's where I've been going. And they said, no, you're going to MedStar. Yay, MedStar. So away we went. And it was like a giant kabuki theater. We had all these people in the metro. The SWAT team was already there to take the perpetrator off the train before I could even get up the stairs to get to the rescue squad. And the rest is history. But his people were just absolutely fantastic because they were so full. They were operating on me in the hallway, which I was greatly appreciative for. And then 2 days later, they literally had shut down all the operating theaters to reboot the computers. So he had to sign my piece of paper just to allow me on the property to get my nose put back on. And so I dearly love this guy, and I've been wanting to say thank you for a long, long time. And here he is today. And thank you very much.
Well, thank you, everyone, and thank you for the opportunity to speak with you today. The hospital center is there for a number of reasons. Stories like this are one of them. But when we talk about the MedStar Washington Hospital Center, we talk about the tale of 2 hospitals. And what do I mean by that? Well, if you ask someone on the street, what do you think of when you hear MedStar Washington Hospital Center? I think one of the most common responses you'll hear is, when I'm sick or I'm hurt, that's where I want to go. And when you look at the 2 hospitals, one of them is provides the care around the services that aren't the critical life-saving service lines like trauma, burn, taking care of seriously ill women who are undergoing childbirth. We'll talk a little bit about them as part of hospital number 2, but we'll talk about hospital number 1, and that's one of the areas that you'll also hear the hospital center known for. So the legislation to approve the funding for the MedStar Washington Hospital Center came out in 1946. And MedStar Washington Hospital Center, then known as Washington Hospital Center, opened in 1958. The building on the left is still there. It's the East Building. At the time, it had a nursing school in it, along with the clinical care that was provided. And the photo on the right is what the front end of the hospital looks like today. Again, if you look at what the hospital center is known for, it is an incredibly large facility, one of the largest in the country. and about the same size as Inova Fairfax, if you look at facilities within the region. We are largely known for our heart and vascular program. We are the primary hospital in the district that does heart transplants and puts in these things that are called VADs, or ventricular assist device, artificial hearts, if you think about it simplistically. For some patients, that's what they're going to live with for the rest of their lives. For other patients, that is a bridge. You know, you need to get that put in now, but at some point, the plan is always to move on to transplant. We also were the region's first comprehensive stroke center. GW now is a comprehensive stroke center, as is MedStar Georgetown University Hospital, but we were the first comprehensive stroke center. So again, if you have heart issues, you come to the hospital center. If you're having a stroke, you come to the hospital center. And then finally, in addition to the trauma that was described, the care that we provide there, we are the region's only burn center. And you might think, well, you know, what's the big deal about having a burn center? You don't know until you need it. We are the burn center that covers from north of Baltimore down into Richmond. And the burn center and MedStar Trauma work collaboratively together to provide the care for those that are suffering those injuries. At the hospital center, we talk about one team. It was noted that I'm a pulmonary critical care medicine physician. In the ICU, one team care is what provides the best outcomes for our patients. It's not the physician, it's not the nurse, it's not the respiratory therapist, it's not the pharmacist. It's all of those people working collaboratively together. And when you take care of a patient population as complex as we have at the hospital center, you need all members of that one team working at the top of their license to ensure that we give the care provided that is absolutely necessary. We have two primary goals. One is to provide the highest quality and safest care for our patients. The second is to provide the best experience for patients, families, and importantly for each other. We know that wellness has increasingly become part of the challenge in healthcare, and we have to have each other's back as we move forward in achieving our goals. We have three goals that we'll talk about throughout the talk. One is to be a 5-star hospital. You're all aware of the ratings that are available online for restaurants, hotels. Healthcare has that same set of ratings. One is a rating that is designated by the Center for Medicare and Medicaid Services. One is a rating from an organization called Leapfrog. And then the other one, which I don't mention here, but I'll mention later, is Magnet designation. That tells the world that from a nursing care standpoint, this is the place. They're providing the top-notch care from a nursing perspective. So we're on our way. We have nearly a 4-star. We have a B grade in Leapfrog, and we will be submitting our Magnet designation packet later this calendar year. MedStar Washington Hospital Center is a small village. We have more than 8,000 people that work there. And you can see that the largest number of people that we have is our nursing staff, more than 2,000. We are a unionized nursing workforce, one of an increasing number of unionized nursing workforces in the city. And we work very closely with that union to ensure that our nurses are being provided with fair wages and a work-life balance as it pertains to the number of patients that they care for, that is safe for our patients, but also in the best interest of our nurses. We have more than 1,600 nurses, dentists, and podiatrists, more than 500 what we call advanced practice providers, physician's assistants, nurse practitioners, certified registered nurse anesthetists, anesthesia associates, and midwives. That number has increased from about 180 when I started here 10 years ago, and we now have more employed advanced practice providers than we have employed physicians. And we are a graduate medical education site. We have residencies and fellows that on any day will have more than 350 trainees at the hospital center. We are a very diverse hospital, diverse from a workforce standpoint, diverse from a patient perspective. The majority of our patients come from wards 4, 5, 7, and 8, largely African American and Hispanic, and from Prince George's County. Counter that and compare that with MedStar Georgetown, which largely gets their patients from the Northwest Washington wards, Montgomery County, and Northern Virginia. It's important that our leadership group looks the same as our patients and as our workforce. And the point here is just to show you the 20 vice presidents and assistant vice presidents that I have the privilege of working with every day. And diversity is very important to me and to this organization. And you can see represented there, we have more females on our leadership team than we have males, and a number of African American and Asian and people from Middle Eastern descent that are part of the team. So what's big? We have more than 800 beds that are largely full every day. There was a comment about surgery being done in the hallway. We don't like to do that, but there are some times when we have patients in the hallway just because there's no other place to put them. We have more than 375 what we call med-surg beds, patients that don't need to be in an ICU, but may have just had surgery or are admitted for a medical reason. We have more than 150 what we call heart and vascular beds. We have a part of the hospital that is defined just by the care of patients with heart disease and vascular disease. We have more than 120 ICU beds. And I will tell you, we use 120 plus ICU beds every day. We deliver more babies than any other hospital in the city. You might not know that. We have the busiest neonatal ICU in the city besides Children's. And because of our proximity to Children's, literally right across the parking lot, we frequently will have mothers that will be transferred to us from all around the country so that either they or their baby can get the care that's necessary over at Children's. We are the busiest psychiatric hospital in the city. Besides those hospitals that are psychiatric hospitals, we have the busiest psychiatric unit. And again, not things that you would think about when you think MedStar Washington Hospital Center. We have more than 40,000 admissions, more than 360,000 outpatient visits, and we have 37 locations around the district, suburban Maryland, and in Virginia, where we see outpatients. And we have an incredibly busy emergency department with nearly 80,000 emergency department visits every day. We have a number of operating rooms, 34 operating rooms that are situated on 4 different floors. The reason they're on different floors is that they're specialized operating rooms. The burn ICU has a burn operating room in it. And why do you need a special burn operating room? Well, when you lose the part of your body that controls temperature is your skin. So if you've lost a lot of your skin due to a burn, if you've ever been in an operating room, you know it's cold. It can't be done in a cold operating room. So those operating rooms are 85 degrees so that we can make sure the patients are protected during that. We do, nearly 6,000 GI procedures, colonoscopy, endoscopy, that kind of thing. And we have 5 interventional radiology suites where you could have anything from a blood clot removed from a stroke to having chemo introduced into a tumor in your liver. And they do all, anything in between that. The primary strategic service line for us is the Heart and Vascular Institute. We have more than 1,000 heart and vascular teammates across the system. The Heart and Vascular Institute is situated at the hospital center, but heart and vascular care is delivered in a number of other places across MedStar. We have 8 cardiac catheterization labs, where you might go if you're having a heart attack. They put a catheter in to try to break up the blockage or put a stent in. And then we have 6 what we call electrophysiology labs. If you have abnormal heart rhythms, that's where you go to have a diagnosis made of, what's causing your atrial fibrillation, what is causing you to have even more serious heart rhythms that may result in having to put a defibrillator in that some people need. We do more than 1,700 cardiac surgeries, more than 95 heart transplants and LVADs, and that number continues to increase every year. Very busy vascular surgery service. Vascular surgeons are doing more and more different procedures, and we're very busy there. And you can see, more than 5,000 cardiac catheterization, electrophysiology procedures that are being done. The second critical service line is our neurosciences service line. Almost 2,600 admissions, almost 1,000 neurosurgical procedures. As I mentioned, we were the first Joint Commission accredited comprehensive stroke center in the region, and we have won multiple awards for the stroke care that is provided at the hospital center. The third strategic service line is our oncology service line. We are part of the Lombardi Cancer Center at Georgetown University Medical Center, which is not part of Georgetown University Hospital, but the medical school. And we provide care to nearly 50,000 patients that require oncology care and more than 11,000 patients that need IV infusions of chemotherapy or need radiation therapy for treatment of their cancer. So we talked about the tale of two hospitals. What I've gone over so far is the first hospital. What do those service lines have in common? They make money. We're all well aware of the challenges that healthcare is having from a financial perspective. You must, in order to be successful, you must have some service lines that make money, not just to support themselves, but to support these services that we've talked about that are absolutely critical to the community, the trauma care that you received, but don't make any money. But they're absolutely necessary to the care that we are, that the citizenry of the district and of the region depend on us for. We have more than 2,400 trauma admissions. You might think that trauma might have changed during COVID. You were attacked during COVID. We saw a lot more motor vehicle accidents during COVID because for those that drove around during COVID, people drove faster and more out of control during COVID because there was less traffic on the road. And we know tragically how busy the Knife and Gun Club of Washington is with all the trauma that we see. From a burn standpoint, again, burns were out of control during COVID. Why, you might ask? Well, people didn't go out for dinner. They were cooking at home. They were playing around with, equipment in the kitchen and were catching themselves on fire as part of that. So we had a significant increase in the burn care that we had to provide during COVID. I mentioned how busy we are from a psychiatry standpoint. We are one of 3 hospitals in the city that take what are called involuntary patients, and those are patients that are committed against their will. And obviously, that patient population is very complex, and the risks of workplace violence associated with that patient population are significant. I talked about the number of births that we have, more than 3,600 births, and about half of those are associated with a baby that is admitted to the neonatal ICU. Think about that. If you go to Sibley, or you go to Holy Cross, which are 2 other big areas in the region where babies are born, you're not going to see that kind of statistic, but it's reflective of the patient population that we have. Maternal mortality in the district is really at sub-Saharan African levels. The number of women that die, the number of babies that die, and that's the patient population that we care for. Again, from the wards within the district where we draw our patients. And then finally, while DC has a great insurance system, the DC Department of Healthcare Finance has an excellent Medicaid program, and DC truly is one of the best insured jurisdictions in the country. We still had over $100 million of charity care that we had to provide, and patients who just couldn't pay their bills associated with that. And you might say, why is that? Well, we have a large number of international patients that literally get off the plane and come to the hospital center for care. And when they reach the point of, okay, they're stable now and they could be discharged home, there's nowhere for them to go. And that is one of the things that contributes to the hospital being as busy as it is that we have patients that we just don't have a place for them to safely go. So again, this is hospital number 2. All of this does not generate revenue, enough revenue to support themselves. But because hospital number 1 is so successful in what they do, we're able to provide the care in those strategic service lines that I mentioned, but also to this important patient population. I don't think Aurel mentioned this, but MedStar is a not-for-profit hospital. MedStar Health is a not-for-profit system, and the hospital center is a not-for-profit hospital as part of that. We've been recognized in a number of publications and by multiple organizations for the work that we do. The hospital is ranked number 2 in the region behind Inova Fairfax. Our heart and vascular program is ranked number 33 in the country. That's for cardiology, cardiac surgery, and for vascular surgery. We're one of America's top 100 hospitals for cardiac care. We are America's in the top 100 of hospitals from a consumer friendliness perspective. And one of the designations that we unexpectedly received this summer was from the Lown Institute, and we were recognized as the most socially responsible hospital in the region and one of 54 hospitals in the country that received an A grade in every category that was assessed. And that includes social responsibility, health equity, the value of care, and patient outcomes. So as I said, our journey is to 5 stars from the Center for Medicare and Medicaid Services review to an A grade in Leapfrog and to be a Magnet Journey hospital. With the 8,000 teammates that I have as part of the one team at MedStar Washington Hospital Center, I know we will be able to achieve it. It's a privilege for us to take care of the patients that come to us for care, irrespective of what brings them in the door. But we are proud of our mission. We're proud of the wide range of patients and diseases and disorders that the MedStar Washington Hospital Center is responsible for. This is the MedStar helicopter. You might say, where did the name MedStar name come from? In 2000, two hospitals in the Washington, D.C. region, NRH and Washington Hospital Center, formed a union with Georgetown University Hospital. MedStar bought it from the university. And they combined with 4 hospitals in Baltimore. MedStar Good Samaritan, Franklin Square, Harbor, and Union Memorial Hospital. Those 7 hospitals were given the name MedStar. Where does that name come from? The helicopter company. The helicopter company is called MedStar, M-E-D, capital M, little e, little d, capital S, capital T, capital A, capital R. Medical, shock, trauma, and acute resuscitation. That's the name of the helicopter company. MedStar, capital M, little ed, capital S, little t-a-r. So that's where the name came from. And then the 12 years after that 7 hospital group was formed, MedStar bought MedStar Montgomery Medical Center, MedStar Southern Maryland Medical Center, and down in Leonardtown, our smallest hospital, MedStar St. Mary's Hospital. So we have 10 hospitals. We have more than 350 buildings, multi-specialty clinics, ambulatory surgery centers that all fly the MedStar flag. And we are the largest healthcare system of the 4 big ones in the region. University of Maryland, Johns Hopkins, and Inova were the biggest of the 4. So with that, I'm happy to answer any questions, and thank you for your time. Yeah.
Thank you, Doctor. 4 years ago, my son-in-law suffered massive heart failure and was kept alive by an LVAD, left ventricle assist device, implanted at MedStar, spinning at over 5,000 RPMs. A week ago, I was not here. I was with my daughter at MedStar while my son-in-law received a heart transplant that was successful. No question, just a hearty thank you for the very professional physicians and staff that are continuing to take care of my son-in-law recovering in ICU at MedStar. Thank you, Doctor.
We have a very well-trained group of critical care physicians, cardiac surgeons, anesthesiologists, et cetera. And we're privileged to have here today with us one of our ICU physicians who is truly an unusual person in that he is trained in cardiology and critical care medicine. That is a very unique skill of which there are not very many, and we're fortunate to have them because you really need that level of expertise to take care of patients who are that complex as your son is. I wish him well. I literally just met him. He's new at the hospital center, so we're lucky to have him.
Give him a warm Rotary welcome.
Yeah.
Doctor, I was a lifelong Washingtonian. I was familiar with the heart expertise of Washington Hospital Center. Can you explain the relationship between your hospital and children's derivation and how children started and how it relates to what you are doing?
There is no formal relationship between them. Children's is an independent hospital. They're not even part of the children's hospital system across the country. We own the land that they sit on. I would say the only relationship that we truly have is that as pediatricians do a better and better job in keeping patients alive with diseases that would have previously killed them in childhood, at some point they need to transition to adult medicine. That's the relationship that we have. So for my specialty, specifically cystic fibrosis, kids with cystic fibrosis used to die. Now they don't. They grow into adulthood and they do very well. But if they get sick, they can't be admitted to Children's Hospital. So my colleagues in pulmonary go over to Children's, see the patients in the clinic that they've been going to for their entire life, you know, the adult part of it and the pediatric part of it. And if they get sick, they come over to the hospital center. We have many service lines where there's that kind of relationship. For cardiology, the pediatric surgeons and the pediatric cardiologists have done a great job in fixing heart issues for children that had congenital heart disease to allow them to lead a normal life. At some point, again, they become adults, and sometimes because of what was done to them as a child, they have ongoing issues that require further treatment. That is another area that we work on. So examples like that, and that most commonly is how we work collaboratively together. And it's just that transition from being a kid to being an adult. And that's a testament to the pediatricians and the pediatric surgeons.
Thank you, Doctor, for your presentation. Just wondering, how does the Metropolitan Washington region compare in terms of quality of healthcare provided with other major metropolitan areas?
Good question. If you look at the rankings that are utilized, you know, the star ratings, the leapfrog ratings, the data for DC, which is a city, really can't be compared to that of a state. You know, a state has a much broader area. They'll have, you know, their metropolitan area, they'll have their suburban area, they'll have their, their rural area. The scores for those hospitals in the city are not as good as than if you looked at, you know, Inova in Virginia and the scores there. But I will tell you, the hospitals all work collaboratively together on a number of programs, processes to try to improve it. Maternal morbidity and mortality is a big one. We have too many women that are dying either pre-childbirth or during childbirth. So we have work to do.
Sir, I am Donnie Shaw, and I just want you to know my house caught on fire in January of 2020, and I was serviced by your burn center. I had first-degree burns on my face, which in the beginning of the burn, you don't know it. You see it the next day if you know how the burns work. And believe you me, I want to give a shout out to Miss Rebecca Alley from the Burn Center. She's a therapist who has been such a wonderful person to work with. And folks don't know that it's an entity, no, it's an affinity group that does gatherings and outside activities together. For instance, they are going skiing on the 27th of this month. But I just want Allie to get credit for the hard work she does dealing with burn victims. And it's been a pleasure working with her.
Well, thanks, Tony. I mean, that's a great example of what we talk about with one team. It's
And
not
this
just
is
the
how
burns.
beautiful I look now. You see, I'm a pretty dude now. Thanks. Yeah, you
You
see.
look great now. You look great, Donnie. No, but again, thank you for recognizing Rebecca. She's well known as a burn therapist, and again, an example of the success and how we get the outcomes that we do, because it's the impact of every member of that team. And it's not just what the burn surgeon does. It's not just what the burn nurses do in the ICU. It's the therapy. It's when you have a burn, your skin loses its stretchiness, and you need to work with the therapists to try to work on trying to have more of a normal movement of the skin. What we've started doing now is working with lasers on burn scars, and that helps significantly in the loosening up of the skin. Just another example.
Hi, my name's Heidi Marcus, and I am a guest of Lisa McCurdy, who happened to actually be born at Washington Hospital Center. She wanted me to mention that. I'm doing a testimonial for NRH, actually. I was and your reputation precedes yourself because of the way that NRH, National Rehabilitation Hospital, works so closely with Washington Hospital Center. And I can attest to this on several levels. They were a client of mine years ago, and then I became one of the original members of the Board of Associates. So I know from the inner workings of how NRH and Washington Hospital Center work together. Also, community outreach activities that they do, very prevalent in the community, discussing with individuals within the community exactly what NRH is, as well as Washington Hospital Center. And also, I co-chaired a lot of events, polo events and silent auctions. But my own mother was treated at NRH, and I could have taken her anywhere. And under the auspices of John Rockwood.
Yep. Very close friend.
Stellar team. So I'm not being paid for this. I was a client. They were a client a long time ago. They did their duty there. And then they immediately put you on and put you to work because of the good works that they really do. And talk about within the community for those underprivileged individuals from different demographics. They really step out and do amazing work for them as well and make everybody feel just as important as everyone else.
Thank you.
So you talked a little bit about equity, and you talked a little bit more about maternal health. I am curious about MedStar's approach on the two of those simultaneously, and maternal health equity specifically.
So we developed a program 3 or 4 years ago called the Safe Baby, Safe Moms program. That was supported by the Clark Foundation with a $30 million grant to support women's health and health pediatrics up to the age 5 on the Georgetown campus. There's only 2 things that we don't do at the hospital center. We don't do kids. Once you've been delivered and you're discharged either from the neonatal ICU or just a normal delivery, you don't come back until you're an adult. And we don't do solid organ transplants besides heart transplants. So the Safe Baby, Safe Moms program is put in place to try to aggressively, proactively engage patients pre-pregnancy and from the early stages of pregnancy on. So that program has already seen significant improvements in maternal and fetal outcomes from that, but we have work to do. That's one example of what we do. And again, that's just several years old. We have a program that's 30 years old. It's called TAP. It's the Teen Alliance for Prepared Parenting. And that is to try to engage with young women, less than 15, who have a pregnancy, to try to do 2 things. One, to get them to be able to get a high school diploma, GED or diploma, and to try to prevent the second pregnancy before they do that. So again, engaging with, and that has been wildly successful, again, because, you all know there's a big difference between having a high school diploma and not in your future. So that's one of the other programs. This is an example of what we do. But we have community involvement programs throughout, a lot around food insecurity, and focusing on wards 7 and 8 there. But our primary focus is on maternal and fetal care and outcomes.
we have a tradition here. Thank you for coming, first of all. And thank you for talking about the, the ratio as far as the life death expectancy, because sometimes that is often overlooked. And the fact that you guys are looking at it seriously now makes me feel great. Thank you very much. We have a tradition here at our club where we give and plant a tree for all of our speakers. And I especially enjoyed your talk today. And here is a pin, and we will plant a tree in your honor.
Thank you.
You can find the GPS coordinates if
Okay.
you look on here.
Thanks to all of you. It's my privilege to be here.